can monitor horses in a more effective way. So when we see horses as clinicians, how do we know if the horse is fit to perform? Because that's very important to know. If you're going to follow up a horse over his competitive season or over a career, you want to make sure that he's able to do what you want him to do. But it's very difficult just by looking at the horse, doing a clinical exam. We're not looking at horses that are sick. We're looking at horses that are still still competing, but not to expectations. So we have to look for subtle clinical signs. And there again, looking at horses during exercise is very interesting, because the horse goes and puts his different systems, cardiovascular system, respiratory system, locomotor system, into action, and that's where things are going to happen. So if the horse is hitting a wall and not at 100% of his fitness, is it because he's just not very good? And that can happen. He doesn't have the genetic potential. Maybe he's not trained appropriately, and that would be difficult for you to judge as a veterinarian. Or does he have a subclinical problem that has remained undetected but still affects his performance? Now, I wanted to present to you the track team, the US cycling team on track. And that's at the London Olympics. But 2 years before the London Olympics, they were nobodies. Nobody had heard of them. They really loved cycling on a track, and they wanted to go to the Olympics. That's the only thing that they knew. So they called a retired elite track cyclist, Chris Christopherson, or no, not Chris Christopherson. He was called Christopherson, but it wasn't Chris. And this guy was a tech geek, and he called on several specialists that monitored absolutely everything. They monitored their cardiac response to exercise. They monitored the temperature at which they reached their maximal speed. They monitored their sleep patterns. They monitored their cycles over time. And that required a lot of technology. But in the end, they got a medal at the Olympics. So even though it was a long process and it required a lot of data analysis, that is actually what helped these women win. In human athletes, it's very common to do exercise testing, to monitor athletes while they're doing exercise by measuring, for instance, oxygen consumption, VO2, by looking at their electrocardiogram, by looking at their saturation in oxygen. All these parameters that allow us to evaluate how the athlete responds to exercise. And if he doesn't respond appropriately, is it because he's got a subclinical issue? So this is my brother Armel. Armel lives in Dubai, and you can see that he's not an elite athlete. You can see that he still is not demotivated. He really wants to run triathlons, and he even got a medal for participation. But what helped him was the use of smart technology. He used Strava to see how he improved his timing when he was running, to see how he improved his cardiac recovery after exercise, to evaluate the duration of his work. And all of this helped him to complete a triathlon. Well, we can do that now in horses as well. We've got smart technology that allows us to monitor a series of simple parameters that indicate the workload, the response of the horse. And that data can be then, it helps us to understand what workload the horses are getting and understand also how they're responding. It can be very, very simple to do. So this is when we do field exercise tests, we have a system that allows to monitor heart rate and the ECG, very important for us veterinarians. We can look at motion analysis by putting inertial motion sensors on the horse. That gives us an idea of workload. We could, if we wanted to, include overground endoscopy, but that's not even compulsory. And you could measure lactates. So lactates will start to increase abnormally quickly or abnormally high if the horse is not oxygenating properly. You have handheld meters that you can use. With all this technology, it gives us a whole idea of how the horses work, how they consume energy, if they've got appropriate oxygen delivery, if they have normal locomotion or not. This is a table showing a few of the systems, the smart systems that are available for horses now. We have the old system Polar, which was available to track horses while they were exercising and measure their heart rates at the same time. That system is, I think, fairly tedious to use because the software that is associated to it is not meant to be used in horses. But you've got other systems like eTracker, Equinety, and the ARIA-NEO Equimeter, which actually have a custom software that is made for that. And they can measure a series of parameters, including locomotion and ECG. So this is one of the very simple systems. It is made for riders. They have an inertial motion unit that is fixed on a girth. And so that is going to track the horse and measure the changes in locomotion. So it's a very simple system, but that gives feedback to the rider. And I think that that is already very interesting because riders don't often realize how much work they're doing or how less work they're doing. You've got more sophisticated systems that are also based on inertial motion units, like this connected saddle. It has an IMU at the pommel, and you can look at the horse over jumps. So it's called the iJump. It gives you the speed, the regularity of the stride, the energy that the horse develops pushing upwards and forwards over the jump, the way that the horse collects his balance after jumping. So a lot of parameters. This is a recording that we did in 9 show jumping horses from the ages of 5 to 9, and you can see how individual their response to jumping is. This is the energy of the jumps, and younger horses tend to have more energy, and the older horses tend to better economize their work. So this is very interesting data. It's a little bit complex. I think that right now it's more research oriented. But it could be interesting for riders as well. You can record the horse's video and superimpose some parameters as you go along. So this is a horse that is jumping at a competition, and you have the regularity of his stride, you have the speed, you have the symmetry when he is going to the jump, his tilt over the jump as well. And it's a way of engaging conversation between the rider, the trainer, and eventually the orthopedic surgeon. This is another system that was designed for racehorses, and it's the system that we now use in horses of all equestrian disciplines. It's the ARIA-NEO Equimeter. It has an inertial motion sensor, and it also can connect to a girth to measure heart rate. It has a GPS navigation system that allows you to track the horse over his course, and then you can indicate the speed, heart rate, stride length, and stride frequency each time the horse works. The beauty of this system is that it does not require to enter the horse's details. You just scan the horse's chip. And I think that that's why this system is being adopted by a lot of trainers. It's because it's extremely simple to use, and it doesn't consume or time and doesn't disrupt the trainings in the morning. So you scan the chip, and then you hook up the system to a girth that contains 2 very large electrodes that are patented. They do not move that much when they're on the horse. So you don't have movement artifacts, and you have a very clean ECG that you can record. We tested the system against the Televet system, which is the gold standard for evaluating ECGs in horses. And we showed perfect correlation between the arrhythmia detection with the Televet and the Equimeter. So that is very exciting news, because that is a system that the trainers use. So they're going to record data even if the horse is doing well. And if the horse is not doing so well, you can actually go and dig into the data. You can have the complete ECG recording. You can have also parameters of heart rate variability. We're not yet quite sure how to interpret HRV, heart rate variability in horses, but the ECG is extremely interesting. In addition to the heart rate, we also have, thanks to the inertial motion unit, we can have detection of changes in stride length and stride frequency, but also the symmetry, the lead that the horse is going at, and vertical motion. Now, why is it interesting to the trainer? Well, even before the horses have started proper training, if you do a canter on a track, you can detect if the horse has more sprinting qualities or is more of a stayer, and decide what type of race or training you should do for what type of race. So these horses are two horses that are going at the same speed, 14 meters per second. And the first horse has a smaller stride length and a higher stride frequency, whereas the other horse has a longer stride length and a lower stride frequency. And that corresponds to a sprinter. If they have smaller stride but higher frequency, they're better at sprinting. And if they've got longer, so you can choose what type of race you're going to train your horse for just based on that. These are innate qualities. You can also discuss with the trainer and the owner, because you've got this data that you're looking at, each of you in your own place. You could be in your office and the trainer could be at the track. You could see that data and decide if the horse is important. Is to make sure that these systems are validated, because if they're not measuring things accurately. We've had systems that measure heart rate. The horses were at 300 beats per minute. They were referred for a problem. They didn't have a problem. It was the monitoring system that was defective. So why are we interested in that? Well, we're interested to monitor the fitness status, see how the horse is evolving over time with his training program, select the horses that are the fittest. This is an example of a standardized exercise test in an eventing horse. And we do the same test over the season of training. So during the initial training in February, which corresponds to these open squares, the heart rate is higher and the lactates are higher. But as you improve your fitness, the responsive heart rate is going to be lower. So in April, when we retest the horse exactly over the same exercise test on the same track with the same rider, we can see that the horse has gone down. So this horse has gotten fitter, and that gray line is the reference at which I want the horse to be. So he's fit to go and perform, and he did that effectively. It's also really interesting to monitor health. So as we said, detecting subclinical diseases, evaluating the functional consequences of a problem. I want to know if it's compatible with even low-level work, yes or no. I can use those systems. I can use it for pre-purchase examinations. I've got a horse with, a heart murmur. I want to see what is his cardiac response during exercise. I can put a system like that very simply. If the horse has been stopped for an injury and has been rehabilitated, is he back to level? It's also a way of monitoring that. So there are very simple ways of doing it. You equip a series of horses. This is a race yard in France, in Chantilly. They're 2-year-olds and they all go out at the same time during their training. So you can look at, this is the recovery, the time they get back to 80 beats per minute after a standard gallop at the track. Horses that recover well have a low time to recovery, and these would be in green. The red line is the average, and the horses that are here in red are not recovering appropriately. These horses, the last 4 horses, were horses with either a cardiac problem or a lower airway problem and had poor oxygen delivery. The horse compensated by maintaining high heart rates during recovery time. So that's a very simple way of deciding if you need to investigate horses or not. What affects heart rate? Well, you can have climatic factors. If I exercise the horses that I see in Europe, and if I exercise them here, they're going to have higher heart rates because the fact that you've got hot conditions will increase the heart rate. Track depth also can affect the horse's cardiac response. But then you have all the intrinsic problems that are linked to clinical issues. Pain, anemia, cardiorespiratory problems will affect your heart rate response. This is, for instance, 2 horses that were exercised simultaneously. The healthy and performing horse, his heart rate was lower during exercise and then decreased more quickly. And this horse that had poor performance had a higher heart rate during exercise and a prolonged recovery. And this horse had a series of issues. He had cardiac arrhythmias, he had subsequent exercise-induced pulmonary hemorrhage, and he had tying up. So just by simply looking at heart rate and heart rate recovery, this gives you an indication that you need to look in deeper. This is a horse that is followed by an Australian trainer. So even though I'm based in Belgium, I can get the recording from the other side of the world. It's a 5-year-old thoroughbred racehorse, and it's been to this new trainer's facility, and the trainer thinks that he's not responding well to conditioning. So he puts up the system on the horse on 2 occasions, and he sees that each time he puts it, the horse is at over 250 beats per minute. Very, very high heart rates. So the vet suggests that we look at the ECG, and the ECG during exercise shows that this horse is in atrial fibrillation. The trainer cannot guess that. He's not, he can't put a stethoscope on the horse. Some do, but this one didn't. And so just by monitoring the horse, we can make the diagnosis and say, well, we can stop the horse from training because his poor response to conditioning is linked to a problem that is critical and needs to be addressed if the horse were to go back to racing. He needs to be defibrillated first. This is another horse in atrial fibrillation. It's a dressage horse on whom we did some exercise tests. Showed that his atrial fibrillation was compatible with exercise. And there he wins a world medal in dressage, even though he's in atrial fibrillation. So monitoring the cardiac response and the ECG allows you to see if the horse has functional consequences of the problem, if it's incompatible or compatible with competition. Another case which I found really interesting is this 2-year-old filly. She had a history of, starting well at the trainer's facility and the trainer's yard. So this is the heart rate after 15 minutes of recovery over standard breezes, and she's got really good recovery. And then at some point, she starts to get abnormal increase in her recovery times. If we look here at I don't know if it's very clear for you, but in red, you've got the heart rate, and in blue, you've got the speed. This is the finish line at the training yard on the track. The speed decreases, and then the heart rate remains really high and takes much longer for the heart rate to start decreasing. So there is a change in phase between speed deceleration and heart rate deceleration. Now, the owner put pressure on the trainer to race the horse, despite the fact that we saw this. And the one you want to look at is number 6. She is here. So she starts taking the lead, and then progressively, as the race goes on, she's going to lose some of the ground and fall out progressively. There she is. And the others continue accelerating, and she completely falls back. And she arrives last. So here during the training, the recording indicated that there was something wrong. But the owner put pressure. No, I want that horse to race anyway. I don't believe in data. We looked at the ECG of that little filly, and she had 10 VPCs per minute during exercise, ventricular premature contractions. So she is markedly arrhythmic during work. That is not compatible with performance, as you can see. She had an associated murmur, and when we did the echocardiogram, we saw that she had mitral regurgitation, and it was already moderate. I already had a dilation of my left atrium. This explains my ventricular ectopies, my supraventricular ectopies, sorry. And so am I going to continue to train this horse? Well, no, there's really nothing much to do. This is going to be something that is going to evolve over time and become worse and worse. So I am better to stop the training right here, retire the horse, and not push him to his limits. If I continue pushing this horse, he can get exercise-induced pulmonary hemorrhage. He could get, of course, poor performance, as we saw, but he could also go into atrial fibrillation, and that's a risk of collapse. So this is just to show you that why to see this horse. We got to see this horse because he had poor performance, but we already had indications that things were going wrong at training. So maybe that's where we need to see things, maybe where we need to look at. Another case is a 2-year-old racehorse as well, thoroughbred. He had been stopped for 6 months after a promising start, and he had a tendon injury. And then the first he returned to training, and he was doing okay. He was not lame anymore. And then they did a first gallop, not at a very high speed, and that horse still sustained exercise-induced pulmonary hemorrhage. We did the BAL, showed that the horse had bled, but there was no inflammation associated to it. So it wasn't likely a primary pulmonary lung issue. Probably there was something more to that story. We looked at the ECG, and there had a horse with a lot of ectopies over the more sustained phases of exercise. That could explain the bleeding. If I've got an arrhythmic horse, it changes the pressures in my pulmonary vasculature, and it can create hypertension and create bleeding. That's a topic that you're going to see tomorrow with Dr. Bailey. So the question was, we don't have any underlying primary pulmonary issue. I don't have anything to treat. The horse has bled and that's it. I've got arrhythmias. Maybe it's a cardiac problem. We did an echocardiogram, perfectly normal. So it's not likely a cardiac problem. The specific markers of heart myocardial damage like troponin I were normal. And that horse was put under anti-inflammatory treatment, thinking that maybe he still has a little bit of pain at the level of the tendons. When he worked under anti-inflammatory treatment, he had much less arrhythmias. He only had 1 or 2 for the same exercise. This is well described in humans. Pain can cause arrhythmias. And so maybe these systems that allow us to monitor the horses during training can tell us if the horse still is painful or not. Because during a regular examination, that horse did not show any lameness. So finally, he was rested a little bit more, treated further, and then his return to work was monitored with that system. And he went back to successfully racing again. And that's something that we have seen now recurrently. Horses with pain also have regular arrhythmias. So it can be caused by pain, it can be caused by hypoxia, which would be linked to a cardiac or a respiratory problem. I think that this is part of a bigger philosophical question. Is we have means to monitor these horses prior to injury. It's very distressing to see a horse having a stress fracture at the racetrack and having to be either put down or retired. And so if we have the possibility of following these horses during training, that's what we need to do. We need to stop working from being called for a horse that has an injury or a poor performance and working from that onwards and doing a post poor performance diagnosis. We need to work on the other way around. That's what they do in humans. For instance, for the football players, the soccer players, if you're American, they have to do a series of clinical exams and exercise tests to be able to be allowed to participate to official competitions. And that includes not only a physical examination, but it includes an ECG and an ECG during an exercise test. And if they don't pass, then they cannot compete. So maybe that's what we can do. Monitor training so that we can not only assess fitness and progress, what would be considered as a normal response, but also detect early on horses that are not responding adequately to training. We've got systems to do it. We've got smart wearable technology that is easy to use, commercially available, not very expensive, and it allows us also to improve our discussion with the trainers. We create a conversation around the horse. And with that, I'll thank you very much.
Thank you very much, Emmanuel, for those beautifully eloquent talks, fantastically illustrated. I can only apologize on behalf of the organizers for the failure of the videos. I empathize with you. We'll come back for questions later, but I just think it's lovely to see how she emphasizes the use of technology combined with looking and seeing and thinking, which are so important. So our next speaker is Professor Laurie Goodrich, a good friend of mine. She has a very long CV. I'm going to read it all. I'm just going to say that she is currently the director of the Orthopedic Research Center at Colorado State University. That's a very eminent position. She's a surgeon, she's a clinician, she's a skier, she's a whitewater rafter, she's a rider, she does everything. And she's going to talk to us this morning about the novel applications of regenerative therapies. Thank you, Laurie.
Thank you, Sue. Appreciate that introduction. Thank you to the organizers. Thank you to Dr. Nibar for asking me to present here today. It's really been a fun experience so far, and I can't wait for the Saudi Cup. Great, thank you. Appreciate that.